Hi, I'm Caroline. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Resident in July 7th, 1999.
All right, this is the correct patient. So I'm going to be performing a focused oxygenation assessment on you. Shouldn't take too long. I will explain the process as we go. If you have any questions or feel uncomfortable at any time, please let me know.
Okay.
So the patient understands the purpose of this exam. So before we begin, can you please empty your bladder
Yes.
and put on this gown?
Okay.
And are you comfortable with the privacy and warmth of this room?
Yes.
So the patient is comfortable and prepared for the exam, as well as also being comfortable with the room. So before I begin my physical assessment, can you please answer a few health history questions?
Yes.
So do you have any problems with your lungs or breathing?
No.
Do you have any chronic respiratory diseases?
No.
And do you have any problem coughing?
No.
Do you have any pain or shortness of breath when breathing?
No.
Okay, and are you or have you ever been a smoker?
No.
Okay, and if the patient had reported yes or any pain, I would have done Old Cart's Ice to further assess. So now I'm going to assess your breathing, so just breathe normally for me. All right, so the patient is sitting upright and relaxed. Breathing is effortless. No accessory muscles are being used and no bulges are noted. The skin color is appropriate for ethnicity and there are no abnormal lesions noted. So now I'm going to get your respiratory rate. Okay, so the respiratory rate is 16, which is normal. And now I'm going to, if I had an O2 sensor, I would put it on and get your O2 saturation, and it would be about 98 to 99%. So now I'm going to inspect your nails. So the nail beds are pink and at a 160 angle, and the lip and oral mucosa is pink as well. Okay, so now I'm going to move behind you and inspect your lower back. So the ribs slope at a 45-degree angle. The spine is straight. The scapula are symmetrical, as well as the posterior thorax. And muscle development appears equal. Okay, so now I'm going to listen to your breath sounds. So each time my stethoscope touches your back, just take a deep breath. Okay, so breath sounds are heard on both the posterior and lateral lung field, and no adventitious sounds were heard on either the posterior or lateral lung field as well. So now I'm going to inspect your chest. So the thorax is symmetrical, the costal angle is 90 degrees, and the AP to lateral diameter is 1 to 2, and the clavicles appear symmetrical as well with equal muscle development. And now I'm going to listen to your lung sounds. So just take a deep breath again. Okay, so breath sounds were heard over all the lung fields and no adventitious sounds were heard as well. So I'm going to palpate your back. So if you feel any pain or discomfort, just let me know. So the posterior thorax should be non-tender and there should be no pain felt over the vertebrae. And did you feel any pain?
No.
Okay, so now I'm going to need you to take a deep breath for me. And again. So there is equal bilateral expansion of the rib cage as well as being symmetrical. And so now I'm going to test vocal fremitus. So Just say 1, 2, 3 each time my hands touch your back.
1, 2, 3. 1, 2, 3. 1, 2, 3.
And the vibrations were palpated equal bilaterally. Now I'm going to touch important areas of your chest. So I'll begin with the trachea. So the trachea is midline and slightly movable. The clavicles are symmetrical with equal muscle development. And the rib cage is stable, symmetrical, and with no pain. So now I'm going to need you to say 1, 2, 3 again.
1, 2, 3. 1, 2, 3. 1, 2, 3.
And the vibrations were palpated equal bilaterally. And that's it.
Thank you.